ISD stands for Integrated Service Delivery.
It's for us to start being able to share information better.
Basically a more child and youth-centered approach as opposed to a systems approach.
Providing service, interdisciplinary.
The teams will consist of a variety of professionals from different backgrounds, social workers, psychologists, nurses.
We do have students who have a great variety of needs, and for us all to work together and pool our resources, communicate together, share information that we have across the departments.
It is a framework that will allow us to enhance the delivery of services.
It's an opportunity for the system to start looking at a different way of trying to meet the needs of kids much earlier on.
Well, this is about collaboration and pooling our resources together.
It's a team approach, and I think team is the only way to go.
The ISD framework was a way of taking a look at how we could do a much better job at integrating the work that we're doing.
We want to have a file that all the information is going to be on one system.
You constantly repeat yourself and tell your story over and over again.
There's not going to be any starting over. I mean, you're going to have the right door the first time.
Avoiding duplication of services or repeating services that may have already been provided.
So I just see this as so positive when we can reach out to social development and to health and to public safety, and we're all part of a collaborative team.
You're guaranteed to meet with professionals representing different disciplines twice a week.
We're now going to have an approach where instead of working from 4 referral systems, 4 intervention plans, 4 different types of assessment processes, that we're able to now work from one.
Our staff within our schools are experts in their field of education, but often the needs of these children require professionals who have other skill sets.
The youth benefits not only from the one professional that they may have been referred to in the past, but from the expertise of all of those professionals.
Ultimately, children and youth are relationship-based, just like adults are.
It has to be a very relationship-based approach where you're looking also not at what's wrong with you or what's wrong with your life, but what are you good at?
My hope is that the kids who are coming through the system now will get the help they need early, and that the family will feel that support.
So we want to use the school system as a point of intake.
The delivery of services is primarily based in schools, as opposed to our current practice, which is primarily an office-based practice.
There'll be less stigma attached to accessing these services.
Non-discriminatory, it's kind of open.
And they will know, they'll know that I'm Heidi that, is at their elementary school on Wednesdays.
It's got a positive kind of feel when you go in.
It's not like making a cold call to an office downtown somewhere.
My daughter has bipolar disorder, which means that the challenges are extraordinary, I think.
We're now turning our attention to, and we should, is the mental health of students.
And we need to have it so that families and children know where to go to access service.
I think the upside, in terms of everybody having more information at the same time, will provide huge benefits.
The more that I read about it, the more I discovered integrated service delivery and how important a link that was.
I believe this framework will allow us to reach many more children and youth.
Pooling our skills and our expertise together to wrap the services around the child, because that's who it's all about, how we can best support each individual child.
The center of the universe of this project is the child.